Lise, and thank you for coming. And the screen is yours.
All right, and I'm sharing my webcam, but I realize that might not work because I'm going to have to make myself
It
super
works.
little.
It works.
It looks
It
kind of
works. I
covering
can
the
see you.
slides, so whoops.
Okay.
Yeah, doesn't really work. Oh well. Okay, so that was me. Um, but welcome everybody, and I'm delighted to be here to just share with you a little bit about my own professional journey with naturopathic medicine, and I'm delighted to speak to a group of people who are considering naturopathic medicine. I think that, as you'll see, it's one of the best decisions I've made. So just a little bit about myself. I knew that I wanted to be a doctor when I was very young. In fact, I remember coming home all excited from third grade. I think that's how old you are in when you're 9. And I ran into this study, and both of my parents are professors, and they did a lot of work at home, and my dad was working at his desk. I said, Dad, 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 I know what I want to be when I grow up. And he said, what? Come tell me. So I sat on his lap, and I said, I want to be a nurse. And he said, that's fantastic. Why do you want to be a nurse? And I told him I wanted to help people, and I wanted to work at a medical clinic, and it was just going to be the greatest thing. And he said, you know, that's really good, and I would support you being a nurse. And I also want you to consider being a doctor. So just, keep both options open. So I thought, doctor, I wonder what that is. So I decided to investigate, and actually even at that young age started to read novels about doctors. That's how I learned about medicine. And one of my favorites was Frank G. Slaughter, which is really funny because every time my father traveled, he would pick up some Frank G. Slaughter novels for me, thinking he was helping my education. In reality, as I learned as I grew older, Frank G. Slaughter basically wrote romance novels, kind of illicit, I might add, just happened to be set in hospitals with doctors. But nonetheless, that was the first part of my education as I remember it. But I was very committed to this path, and in fact, so much so that when I was accepted to Brown University, I was accepted to their 7-year medical program, which was a really phenomenal thing for me. A 7-year med program acceptance is acceptance to the undergrad program and then a pre-acceptance to medical school. And the idea behind these programs is that they wanted to create more well-rounded doctors. So we had to take the pre-med, but they really didn't want us to major in pre-med sciences. They wanted us to major in the liberal arts. They gave us also, as a part of that program, a lot of early rotations. So we had some time where we spent, a couple of weeks at a time with, say, a surgeon, and even scrubbing into surgeries, or, another kind of doctor. So we got some early exposures, and at the same time, we're encouraged to branch out in terms of our education, and that turned out to be very helpful for me. I found medical anthropology, which I just loved, and it was an eye-opening experience for me. It really showed me that my understanding of health and healing was very limited, and that in fact, if we looked around the world, how people practice health and healing globally is just phenomenally diverse. And I began to understand that the conventional medical approach was a very narrow window of a very wide array of approaches. So I was just enthralled with medical anthropology, and still thought, well, I could probably integrate this into my medical work, but at the same time I was getting these early rotations, and there was a pivotal moment for me when I had scrubbed into a surgery of an elderly woman who I had met during the pre-surgical consult, and then she was in there to have part of her colon removed due to colon cancer, and I was standing on a stool right by her head, and because it was abdominal surgery, there were all these drapes across her abdomen, and they would kind of flip organs out and rest them on the rest of the abdomen. They would take these huge, they look like quart-sized containers of saline, just dump it in the abdomen, and then took what looked like a vacuum cleaner and suction the water out. I mean, it's just all this stuff happening down there. And then I would look down and there was a sheet that kind of blocked the head of this patient with from the rest of her body. So I would look down and see all this stuff happening in her abdomen, and then I would look down at this person's head, her face, who I remembered, and I could not connect her face, her person, with what was happening to her body. It was a very disconcerting experience for me. And I think surgery is incredibly important, and I have nothing at all against surgery, but I realized in that moment that I didn't want to be a surgeon, number one, and that there was something about that way of practicing medicine that was not resonating with me. Around that same time, I was in I took an elective class where people who had come through the treatment for cancer mostly were speaking to us as patients, and all of them, without exception, were utilizing conventional treatments, but they were also utilizing other therapies. They talked about using acupuncture, they talked about using herbs and nutritional supplements, and it was also very eye-opening, given my learnings of medical anthropology, to see that there were actually some different ways of approaching health even in this country. And mind you, this was, 30 years ago almost, so it was quite some time ago, but actually, yeah, more than 30 years ago. So that was kind of the two major pivotal events for me, and from those events I really became very committed to looking at alternatives. I took my MCATs. I was literally on the threshold of entering medical school. I mean, figuratively, my foot was, across the door, and I thought, I just can't do it. So I pulled back, and I decided not to do that. I didn't know what I was going to do. I went to the Peace Corps, volunteered for the Peace Corps for a while. I came back and I trained as an EMT, and I thought, well, gosh, maybe I'll do public health. I don't know. And then I went actually to an acupuncturist, was getting an acupuncture treatment. At the end, she said, I think you might be interested in this. And she gave me a catalog, and I didn't open it, but I just took it and thanked her. And then I went home, opened the mailbox, and there was an envelope from one of my mother's friends, and he sent me this envelope. He said, I just found this. I thought you might be interested. It was the same catalog, and both catalogs were for, at the time, John Bastyr University of Naturopathic Medicine. So I thought, well, this is a pretty strong message. So I opened it up and read the principles of naturopathic medicine, and my heart was stolen right away. And called the university. I was able to get a quick interview and actually started that fall, and have not looked back since. I am absolutely delighted to have chosen naturopathic medicine, and spent, not only did I kind of stay at Bastyr for my training, I did a residency there, and then I stayed on as a faculty member. I was clinical medical director for a while. I chaired the botanical medicine department, so I was very involved in the university. I'm no longer at the university, but I have taken my career in lots of different directions. So I've been in practice actually for 23 years now, and I've always had a clinical practice throughout that time, and actually it's always been part-time, so I've never been a full-time clinician. But right now my practice is about a day and a half a week, and the reason it's a smaller portion of time, excuse me, is because I do a lot of other things, all of which are applications of my naturopathic medical training. So kind of stepping back just for a second, early on in my career I did part-time clinical practice. I also supervised in the clinic and did administrative work and taught, so I kind of had that mix going for a while. And then that's evolved to where I'm at currently, which is, in addition to my private practice, I'm the executive director of a nonprofit educational resource for integrative healthcare practitioners called TAP Integrative. And this is a place where we gather information from experienced clinicians, we peer review it, we vet it against the evidence base, and then we present it on a website that's a member website to other clinicians so that we can learn from each other. And so that's been just a joy of mine. I love education and teaching, so this has really been fun. And we have a membership that's very diverse. So about 40% of our members are naturopathic doctors, about 30% are medical doctors, about 20% are chiropractic doctors, and then the rest, if I'm getting my percents right, is a mixture of nutritionists and acupuncturists and so forth. So really rich discussions and a great fun thing for me. I also have I've written some books, and I've done a lot of work with a publisher and friend of mine, Carolyn Gazella, and together we've also co-founded a startup a couple of years ago, which is the company is called 5 to Thrive, and our web-based application is called iThrive. And what this is basically it takes core naturopathic principles that are lifestyle-based, so a lot of the core dietary information that we learn, some of the information we learn about exercise, stress management, which what we call rejuvenation in the app, environmental medicine, spirit, and we put all that into a personalized web application for cancer survivors. My specialty has become cancer, and I'll talk about that in a moment. And so we sell to cancer centers, cancer hospitals, as well as directly to people who have been through cancer treatment. And it's a way to infuse the typically very conventional experience of cancer with core naturopathic principles. So that's been quite a delight. Certainly a very much a labor of love, because it is a labor doing a startup, but that's another thing I devote a lot of my time to. And then I do a lot of speaking around the world, and have been fortunate to be invited to fun places to share my knowledge and learn from others. And I also spend a pretty good amount of my time volunteering for the profession. As Joanne mentioned, I used to be president of the AANP, which is our national association, professional association. I've been president and worked in state associations, and currently am the president of the Oncology Association of Naturopathic Naturopathic Physicians, which is a organization that represents those naturopathic doctors that have a specialty within oncology. So just to explain that a little bit, most naturopathic doctors graduate with a general practice kind of approach, and then they go on to become general family practice type of doctors. But there is the ability within naturopathic medicine to focus in on a particular area. For me, that started when I was employed at a cancer specialty hospital, where I did both clinical work and administrative work, and then from there really dove deep into naturopathic oncology. I just love this focus and have continued that into my practice. So my current clinical practice is 100% focused on providing naturopathic care to people who have been diagnosed with cancer in their lifetime. So that's kind of where I'm at with my clinical practice, and I thought that would be briefer than it was, but there you have it. So why naturopathic medicine? You know, I think for me, naturopathic medicine is really rather unique, and I feel like I can say this with some confidence because of my speaking. I've really interacted a lot with other kinds of practitioners. So I speak to medical doctors quite often, and not just at integrative conferences where they're sort of like-minded, but even in sort of typical conventional settings. And so I feel like I've been able to, and I worked at a conventional hospital, so I've really been able to experience the different ways in that each of these practitioner types approaches their work. And one of the things that I think is rather unique about naturopathic doctors is that everyone, without exception, comes into naturopathic medicine because they're passionate about health, they're passionate about healing, and fundamentally they're passionate about people. And they really are very mission driven. And it's not a profession for people who are just kind of looking for something to do or looking for an alternative way to get to a medical practice. It's definitely about really wanting to make a difference and to be an active participant in transforming healthcare in this country, perhaps globally. There are many naturopathic doctors that practice globally, and really based on the idea that we can stimulate or we can empower health in people if we just give them the education and the tools, and ideally using tools that are as natural as possible, but also, of course, we have training in certain procedures and drugs so we can move up that ladder as needed. But really what gets us excited is when we can educate somebody about why they might be feeling unwell, and then empower them with tools they can implement in their daily life and then achieve better wellness. That's what gets us really excited. And the more I practice, the longer I practice, the more excited I get. And it's just because I see the power of this medicine. I'm excited to see the way that naturopathic medicine has grown in in acceptance, particularly among conventional providers. And again, I see this, when I first started speaking to medical doctors, I would be literally shaking off stage, waiting to go up there and just worried about what kind of questions I was going to get thrown. And now it's just a very different experience. People, medical doctors come because they want to learn. Their patients are asking them, they're interested, and so there's a lot more acceptance. I think that's in part also because naturopathic medicine, when we're talking about the naturopathic medicine that comes out of these accredited naturopathic medical schools, is science-based. So we're really speaking the same language, and we just have a different tool set. And again, we have this kind of passion and desire to stimulate the healing response that's a little different. But fundamentally, there's a lot of things that unite us with other kind of practitioners. And then for me, naturopathic oncology is really about it's like taking a microscope or magnifying glass down into the science and this really whole person-centered care. Cancer is a transformative experience for people. So for me, they're very rich and very meaningful relationships that I have with my patients. And at the same time, the stakes are so high, I have to be very science-based in my approach. So I get to exercise my left and my right brain, every time I'm interacting with patients. So that for me is very fulfilling. So my weekly routine is, as you might imagine, quite varied, and no day is really the same. So I kind of drew this picture just to give you a sense of what things I engage with, and I do have to preface this by saying that I work probably too much and too long. So that's something that I continue to try to work on, but I'm doing a lot. So there you have it. So clinical practice, I provide these consults. My practice is such that I do inpatient practice visits at my clinical practice, and then I also provide video visits. So that's kind of a form of telemedicine. And I do a lot of charting. I mean, there's a lot of paperwork in medicine, so I would say I put almost as much time for every visit into my charting, both prep and post follow-up charting, as I do in the visit. So for me, and I do a lot of very detailed charting, so it's a little bit perhaps unusual, but there's a lot of paperwork involved. So there's that clinical practice, and moving around towards the right. My startup business is, as a startup nowadays, especially a health technology startup, you have to be very agile. There's a lot of things happening. You have to be very responsive. So sometimes I might be working on sales. I might be working to raise capital. I might be managing the team, creating content. So lots of different things happening there. My volunteer work is primarily volunteer board meetings, working on projects that the board has prioritized, doing strategic work. And just had a board meeting last night, as a matter of fact, on our annual strategies. That was fun. And then public awareness and education. So I do professional presentations, probably about 1 or 2 a month on average. And it varies, of course, the time of year. Some of these are webinars. Some of these are traveling to conferences. I have a radio show that I have every week with Carolyn, my co-author and co-founder, and we have guests, typically integrative healthcare practitioners as guests, and we talk about various topics related to integrative healthcare. So that's once a week, do some interviews, etc., do some writing. And then my TAP Integrative job, that educational resource for integrative healthcare practitioners, again, strategy, planning, meetings, do a lot of content review, work on projects, correspondence, organizing things. And then, of course, the center of all this is my daily attempt to live a balanced life, which for me means exercise. I start every day with a walk of my partner and I walk our dog, and then I come back, I work out, I have a nice breakfast, and then I work a long day and try to finish every day with time with friends and family and make sure to have fun. So that's kind of my life in a nutshell. In terms of my future plans.
So, Lise, this is Joanne. I think just in the sake of time, we should probably skip forward to the oncology slides, just because I'm getting a bunch of questions from people just in regards to the actual topic. So I think it might be good to maybe skip over to those and see if we can touch on these
I don't know if I have any oncology slides, to be honest. Let me just.
Well, I think there was a patient case.
No.
Oh, okay.
But I can just talk about oncology if you want, and kind of give an example of a case.
That would be awesome. Thank you.
Yep. So let me get off this so we're not distracted. So, so a typical kind of visit or oncology case, comes generally, most of my patients are receiving conventional medical care and are seeking complementary care. So for example, I just had a new patient who has been recently diagnosed with breast cancer, and in fact, when she first saw me, she had already completed her surgery and she was just initiating what we call aromatase inhibitor therapy. So this is an endocrine therapy that's used for cancers, breast cancers that are estrogen receptor positive. So her concern was, how do I prevent some of the side effects of this drug? Well, first of all, she wanted to know, what do you think? Should I take this? And are there any alternatives? And then, if I do decide to take this, I'm concerned about side effects. So are there some things naturopathically that you can do to help prevent or minimize my side effects? And then thirdly, what else can I do naturopathically to help minimize my risks? So the first visit was a lot of education, and we talked a lot about aromatase inhibitors and the benefits and disadvantages, and given her particular cancer. And this is an important role that I play a lot. If you were diagnosed with cancer and you went into your oncologist and your oncologist said, I think you should take this drug, you would expect that from the oncologist. So it carries a very different kind of impact when you go to a naturopathic doctor, and the naturopathic doctor says, well, here's the advantages of that drug, and here's some of the consequences, and here's some of the things we can do about the consequences. Here's the alternatives or not. And so the conversation is very valued typically. And again, that's an example of where I need to be really up on the science and the evidence for that. So we talked a lot about that. In her case, it was my opinion that the aromatase inhibitor therapy would be worth her starting, and she agreed. So then the next part of the visit was really talking about some of the concerns around aromatase inhibitors and how to prevent those bone loss and some of the menopausal type symptoms. So we spent a lot of time talking about what to expect and some of the therapies that I would be recommending to her from a lifestyle perspective: diet, exercise, stress management, and dietary supplements. And then I put all that together in a plan and sent that off to her. So that would be kind of a very typical visit. I asked her to follow up with me. I also recommended some lab tests that I wanted her to do to help me get a better sense of what we call the oncogenic milieu, or sort of the environment in the body that can make it easier or more difficult for cancer to grow. And so we talked a little bit about some ways that I can use tests to help assess that risk or that terrain a bit better, and then with that information develop more targeted therapy. So she's going to go out and get some more lab tests, and then we're going to follow up in about 4 weeks to kind of discuss the lab tests, see how she's doing, and make adjustments. So Joanne, I don't know if there's anything else you want me to elaborate on with that?
Yeah, no, I think so. I think in general, folks were just very interested to hear about how naturopathic physicians approach oncology, and some of the questions that I'm getting here are, in general, how you have seen natural therapies work with conventional oncology treatments, and what is the place for one versus the other, and how do we balance that, and how does somebody who has a FABNO or who has gone through a fellowship in naturopathic oncology, how do you work with the conventional model and really balance the care for what's best for the patient and what's evidence-based and evidence-informed?
Yeah, so that's a lot, but so basically, let me just say this, that cancer is a very serious diagnosis. It's a life-threatening diagnosis, and as such, it's not a time, in my opinion, where we can experiment. If somebody comes in with irritable bowel syndrome, that's a function. They're not going to die from their irritable bowel syndrome in most cases, and maybe, but rarely. So there's a little bit more room to use therapies that we have reason to think will work, but maybe we don't have evidence to know that they'll work. And as opposed to that, cancer is, you don't have that kind of luxury of time or experimentation. So most of the naturopathic therapies have to be very well based in good, clear science in terms of ideally clinical studies, but of course we don't always have clinical studies for what we use. So that if we don't, then we have to have very solid rationale, and in that case make sure that what we're doing is not going to be harmful. So with that sort of background, I will say that from a naturopathic oncology perspective, we are typically very open to any therapy that's going to be effective at destroying the cancer before it destroys the life of the person. And that includes conventional therapies. So there's nothing really inherently wrong with conventional therapies. They are tough, they're a bit crude, they're getting a little bit better, but they're difficult, they have side effects, they're scary, all that's true, and they can be very effective in certain situations. So, generally naturopathic oncologists will work with patients while they're getting conventional therapies and provide them with strategies to minimize some of those toxicities and provide additional anti-cancer therapies. There are certainly times when somebody's really the benefit of conventional therapy is minimal, or they are not a candidate for conventional therapy for one reason or another, and in that case, naturopathic medicine has a lot of strategies to offer to prolong life in terms of quantity and most definitely improve quality of life. So without hesitation, I will say that naturopathic medicine improves quality of life with people diagnosed with cancer at any point along their journey, and in most cases improves the quantity of life. Does naturopathic medicine cure cancer? I think that it can happen. There's kind of that bell-shaped curve, so there are some people where that can happen, and I think that's rare, to be honest. I think that in most cases what our therapies do best is to make people healthier while they have the diagnosis of cancer and to give them more quantity of life.
Thank you so much. So Lise, I've got a couple questions in here about nutritional components of therapy for cancer patients or patients with cancer. And maybe if you can speak generally on nutrition and cancer patients, and then there are some questions on ketogenic diets, Gerson diets, some of the name-specific diets. But if you can talk in general about nutrition and cancer, that would be fabulous.
Yeah, so nutrition is very important, and if you were to let's just for a moment look through the lens of an anti-cancer. What anti-cancer benefit does diet potentially have? If you look at all of the clinical studies and you kind of put them all into a big basket and isolate out the benefit, you get about a 25 to 30% risk reduction, either risk reduction of recurrence or risk reduction in terms of initial diagnosis. So what that tells us is that a perfect diet, whatever that might be for somebody, is probably in most cases, and again this is all statistics, so there's always going to be exceptions to the rule, but statistically speaking, you're going to make a big difference in terms of reducing the risk of both developing cancer and having it recur, but it's also not likely going to be a cure on its own. So diet by itself is not something I would rely on solely, and that's important because if you go to Dr. Google and look for cancer cures, there's all sorts of diets that will supposedly cure cancer, and I just don't see that happening in the vast majority of people that I've treated. That being said, the diet that does make a difference, if you look across the studies and see what do they have in common, because there's so many different dietary approaches out there. What's the common denominator in these diets? It is eating a plant-based diet, and that would be consistent with Mediterranean style diet, that would be consistent with a plant full paleo style diet, that would be consistent with a ketogenic diet. So it all really comes down to the plants that are in the diet, and that makes total sense to me, because if you look at the science of plants and what they do to us, plants are the only place that we can get a very important compound called flavonoids. They're only found in plants, and their plants are chock full of them, and we have evolved to need these flavonoids to perform or to support our immune system, to stimulate certain direct anti-cancer actions, cell-killing actions, cells that are deformed or mutated. I mean, flavonoids are critical in our defense against cancer and other things. So we have to eat a lot of plants. So to me, without a doubt, that's the bottom line in terms of diet. Now, there are some situations where a more dramatic dietary approach can be helpful. For example, the ketogenic diet. One of the sort of newer approaches to cancer, and it's still very early. The clinical trials are really not existent on this yet. There's some published case reports. Even one of the main proponents of the ketogenic diet has sort of prefaced his enthusiasm with a comment that he's seen this slow cancer down. He hasn't really seen it cure cancer. So it's not, again, a cure for cancer, but a ketogenic diet, which is essentially a high-fat, very low, I mean almost, very low carbohydrate diet. So it's mostly kind of vegetable, plant foods, some protein, and a lot of fats. That diet can change the chemical milieu of the body in such a way that it deprives the cancer cells of some factors it needs to grow, particularly insulin growth factor 1. Now, having said that, it's not the typical ketogenic diet in cancer. It's a low-calorie ketogenic diet. So just doing a ketogenic diet, which would be akin to, say, an Atkins type of diet with just a lot of fat, won't work. It has to be very low-calorie. So it's a very difficult diet for people to sustain. But I have seen that in some advanced cancers provide some disease stabilization. And then typically there's a little tumor escape that happens after a period of time, so then people have to switch back to a different kind of diet. So I don't consider it a long-term strategy for people, but it can be very impactful for for fairly long period of time in some individuals.
Thank you so much, Lise. So one other question's come in. Actually, there are a few questions that have come in regards to, you spoke about technology in your practice and charting, and what types of technology you found helpful from a practice management perspective?
Yeah, so I am fully kind of web-based, if you will. So I use an electronic health record system. This particular one was actually designed by a naturopathic doctor, so it has sort of naturopathic practice in mind in the way it was designed. So I use that. I have a secure encrypted email service that I use to message to my patients. I have a HIPAA compliant video service that I use for my video consultations, and I kind of have two screens, so my monitor when I'm with the patient is basically on PubMed, and other resources are open, like Up to Date and things like that, so I can research and be learning as I'm going when questions come up. So I'm very heavily reliant on electronic apps. There's a lot of apps that are out there that help us to keep up to date. I mean, it's just impossible. There's so much information that's just flowing, and even in just if you just focus on one area, like for me with oncology, I can't keep up with oncology, and that's true in conventional oncology too. There's most oncologists now specialize in one cancer type, and even in one subtype of that cancer. Like, for example, there are medical oncologists that specialize in triple-negative breast cancer. It's one subtype of breast cancer, and they can't even keep up. So, I mean, it's just there's a lot of information, but we do the best we can. And so I think all this electronic data, the data stream that we can dip into is really important. And I think also learning to, or spending the time to go to conferences and to learn in that venue is a really good way, an important way to kind of keep current in practice as well.
Can you speak to the mind-body connection and mental, emotional, spiritual components of working with oncology patients?
Yes, this is something that one of the reasons I love this focus area, because when people are diagnosed with cancer, regardless of the kind or stage of cancer, all of a sudden they're facing their mortality in a very acute way. Whereas, we're all terminal, but it's sort of a distant thing we don't think about every day. But when you have a diagnosis of cancer, all of a sudden it becomes a reality for right now. And as a result, it invariably causes a shifting of priorities. So people realize, gosh, am I spending my precious time on this planet in the way that's most fulfilling and meaningful to me? Am I being the best person on this planet that I want to be? Am I being of service in the way I want to be of service? Am I surrounded by the people that I love? Am I doing the right job? Am I in the right relationship? So all these things kind of come up for people. And as a result, when they're working with me, particularly as a naturopathic doctor who is interested in all of this, and in my questioning includes questions and creates a space for them to discuss some of this, it becomes, not only is the relationship very wonderful, but it also helps me to see very clearly how critical this emotional and spiritual sense of well-being impacts their physical health, and vice versa, of course, and how important it is to prioritize that. So I talk to my patients very directly about, of course, stress management, but also about integrity. I talk to them about mindfulness. I talk to them about how they view their mission. What's their mission on this planet? So all these things are part of my day-to-day kind of conversations with patients, and I think that I'm fortunate in that the doors opened from the diagnosis. That's one of the blessings of cancer, if you can call it that. But the door's already open, so people are ready for those conversations. I don't have to kind of get them there, and that's, to me, really one of the most rewarding aspects of practicing naturopathic oncology.
That was very powerful. Thank you, Lise. I remember a quote what I heard years ago: "Life is a terminal disease." But I think that you really couched it well, and I know that there are a bunch of questions coming in here that are a bit more specific and targeted on types of cancer therapies. Folks are just really hungry to know all of the different ways that naturopathic doctors work with oncology patients and how it's different from the conventional model. So I'm wondering if you can speak maybe to some of the therapies, supplements, stem cells, IVs, various different things that NDs do that are different than somebody going strictly with the conventional model.
Yeah. Okay, so obviously there's a lot. But first of all, I would say that I understand why there's a lot of questions, because there's no really good, solid storehouse or warehouse of information to get totally trustworthy information. So it becomes very hard and confusing for people to understand what the options are. But the point being, there are options, and there are lots of them. So from a naturopathic perspective, I think fundamentally, every naturopathic doctor who is working with somebody who's diagnosed with cancer is going to find ways to optimize the health of their diet, and again, hopefully mostly centered around that plant-based concept. And then exercise has emerged as a really critical component of wellness, and there's really a continuum of intervention that we talk with people about. So in my practice, I often speak about exercise as a dedicated commitment to movement on a regular basis, and there's lots of data to show the power that regular exercise has in reducing cancer risk, extending overall survival once diagnosed. And on the other end of that continuum is sedentaryism, and we can be heavy exercisers in the morning and we can be totally sedentary the rest of the day. I had a big aha about 5 years ago where I realized that's me, and so I've had to really work hard to not be sedentary during the day, because being sedentary is actually considered the new smoking in terms of its impact on the risk of developing cancer and the risk of dying from cancer. So we really help guide people in that. And then, of course, the impact of stress is just tremendous, and there's lots of now biochemical understanding of that connection. And so we really work hard to give people an understanding and awareness of their stress and the stress management techniques, and that, of course, bridges into the spiritual well-being. So that's kind of the foundation. Now on top of that, I call that the three-legged stool. So we have diet, movement, and then kind of psychosocial support. Those are the three legs. Now we've got a stool. We can sit on top of that stool, some of the more targeted therapies. So these targeted therapies are very cancer specific. They're stage specific, so early or advanced cancer. They're in some cases, sex specific, male, female, or age specific. So there's a lot of nuances that goes into this. But what we want to put on top of that stool are, number one, dietary supplements. I'm a big fan of dietary supplements. I make I have no problem saying that. There are certain when we can concentrate certain compounds like curcumin from turmeric or EGCG from green tea, and even if the capsule contains kind of a whole green tea extract, but with extra amounts of certain of those flavonoids, or the role of fish oils, or resveratrol, vitamin D, these are some of the heavy hitters, but there are many different supplements, again, depending on the cancer type, etc. So we can use these to in higher doses than we can eat, essentially, and when we take them as supplements, we're able to manipulate to some extent physiology. So we can, say with medicinal mushrooms, we might be able to stimulate cytotoxic T cells to directly attack tumor cells. Or with resveratrol, we might be able to increase the rate of apoptosis, which is cell suicide, particularly in damaged cells like cancer cells. So there's lots of ways we can do that, and again, the data is emerging, so we can actually pair to some extent certain of those compounds or supplements with certain cancer types and stages, etc. So dietary supplements are really important. And then there are many of my colleagues, because of the nature of my practice, I don't do this as much, but certainly refer for it, and that's with intravenous therapies. So intravenous therapies in oncology include nutritional IVs, just to help kind of get people back on their feet between treatments. Intravenous vitamin C is recommended quite often, and there's an emerging body of data which really does support the intravenous vitamin C as a direct anti-cancer tool. So it's almost like a natural chemotherapy, not nearly as strong, but does have some anti-cancer effects. Definitely helps to improve people's well-being between treatments. So that's a kind of a mainstay. And there are other more, let me just, how do I say this? They're researched, but typically not in the US. So there are other therapies that are delivered intravenously specifically for their anti-cancer effects. And these, again, are done usually in the context of a particular cancer type. Artemisinin is an example of that. Lipoic acid is another example. So these are all things that naturopathic doctors will sometimes include in their recommendations or prescriptions for patients. And then beyond IV therapies, there are even more types of therapies. There's some naturopathic doctors that have learned or received extra training in techniques like local regional hyperthermia. In fact, there's a naturopathic doctor in Canada who's really one of the world's experts in that, and that's a way to deliver kind of targeted anti-cancer actions or immune-stimulating actions in a particular region of the body. So those type of therapies are available as well. And probably missing some more, but I guess that's what comes to mind. I think that's kind of a generally very broad scoped idea of what naturopathic oncology tends to focus on and deliver.
Thank you. So a couple questions. Let's see, I can take a few of these, but there's a question about thermography and mammography and one versus the other, and is there a place for either or both?
So thermography is appealing because it doesn't involve any radiation exposure, and it basically is using blood flow and heat generated from blood flow to determine abnormal areas of the breast. And thermography, I think, is good for assessing the health of the breast. In other words, with thermography, I think you can actually get a pretty good idea of whether There is a lot of fibrocystic tissue going on in general. What, is there good even blood flow throughout the breast tissue, etc. I don't think it's very good at finding cancer. There have been some times, definitely have had a couple of patients in my thousands who have said thermography found my tumor when nothing else did, but actually the opposite is generally true. In fact, the patient I just was talking about earlier had been using thermography as her screening method, and then finally her primary care doctor said, I really think you should get a mammogram since you're in your 60s now. And she did, and they found a 2-centimeter tumor. So the reason that thermography doesn't catch breast cancers very well is because by the time the earliest stage of a breast cancer is not necessarily going to have a lot of increased blood flow. So it's not necessarily going to be picked up as abnormal on the thermogram, and it will show up on a mammogram. Once something gets advanced, there's a lot of blood flow in it, it should be found on thermography, but by that time it's pretty big, and it should also, could have been diagnosed earlier. So I think thermography is, valuable, again, to just monitor the health of breast tissue. I would not rely on it as a primary screening tool for breast cancer. If you do it in parallel with mammograms, you get consistent findings that overlap. Maybe you could use it to monitor things over time, but it's just, unfortunately, as much as I'd love to say it's as accurate, my experience has been that, and my understanding of the research is that it's not a reliable screening tool.
Thank you so much. There are a couple additional questions here. Folks always want to know about nutrition, and so there are questions regarding plant-based diets that you've spoken about, and raw versus cooked, and your thoughts on raw food diets.
Yeah, so I have no problem against raw food diets as long as you, the eater, enjoys them and eats enough. I think that the argument for raw foods diet is that the enzymes in plants are present, so you get more enzymes, therefore helping to facilitate digestion. The vitamins and minerals are not denatured in any way by cooking. Having said that, I kind of, for these questions, rather than go on my own belief systems, because diet is so personal, I like to go to the literature. So if you look at the published literature, what we know is that just eating more plants, cooked, raw, anyway, will give you significant benefit in terms of lowering the risk of cancer, of Alzheimer's disease, of cardiovascular disease, of various arthralgias, all sorts of chronic illnesses. So it seems as though we just need more plant food, cooked or not. And so I'm not that finicky about making sure people eat raw only. I am very finicky about making sure that people eat a wide variety of vegetables. I talk about the rainbow approach, so that you want to see at least 5 colors on your collective daily plate, so that you should be consuming a number of different types of vegetables, because each vegetable has a different array of these bioflavonoids. There are over 4,000 bioflavonoids found in vegetables that have medicinal activity, and you're not going to get all those from 1 or 2 or 3 vegetables. So it's really the variety that makes a difference, and the data is emerging now that we really get the most benefit when we consume, ready for this, 7 to 10 servings of vegetables a day. So a serving being a half a cup of cooked or a cup of raw. So you can get that actually in a big, huge salad if you want to do it all at once, or you have to have usually about 1/3 to 1/2 of your plate full of vegetables at every meal. And fruits too, vegetables, usually I recommend like 2 to 3 servings of vegetables to every 1 serving of fruit. But that's kind of the fundamental for me in terms of dietary recommendations. Now, once people start eating vegetables, of course, the other corollary to that is to minimize processed and refined carbohydrates. So if there's foods that are in plastic packages that contain ingredients that you can't pronounce, or if you had that ingredient in your kitchen, you wouldn't know what to do with it, that's a processed food that goes out. And if it's got a lot of white sugar in it, or white flour, that shouldn't be in your daily diet either. Occasionally, no big deal. I mean, our body is very resilient. We can handle deviations, especially if we build a strong foundation of plant-based foods, good quality oils from nuts and seeds, good quality proteins from organic grass-fed meat or fish or good plant, legumes. That kind of sets such a strong, resilient foundation that we can have an occasional dessert, no big deal. But we don't want to have that every day all the time, and that should certainly not be the staple of our diet.
Thank you. Can you speak, and I know we're coming close to time. I've got room for maybe a couple more questions here. Can you speak to the role of inflammation in cancer and cancer development?
Yeah, absolutely. So in general, when we have what we call chronic inflammation, which is, acute inflammation is the reaction we see when we cut ourselves, swelling, redness, etc. But if you think about what's happening in that acute inflammatory reaction, in order to heal that cut, our body, the tissue releases compounds which signal blood flow into the area to bring nutrients in. The compounds stimulate more rapid cell division to kind of heal up that tissue. And those chemicals serve the purpose in an acute, limited way. But if there's something in the body that's perpetuating those same chemicals to be released on a chronic basis, then what tends to happen is we elevate the amount of, or the degree of cellular proliferation. So our cells generally start to divide more rapidly, especially in wherever that kind of trigger is happening. But those chemicals circulate systemically, so there is some increase throughout the body. We have more blood flow or more angiogenesis, so it's easier to grow new blood vessels. These are all things that are absolutely necessary for tumor development. And there's some really interesting work now that is suggesting that tumors start maybe because there's a mutation in the DNA that kind of starts the cell population to grow wildly, but probably more likely that happens all the time, but those don't develop into tumors because the surrounding tissue, the stroma, as we call it, of the body holds those aberrant cells in check and actually stimulates their demise. But when we have these chronic inflammatory signaling pathways upregulated, the stromal tissue becomes dysregulated and its ability to restrain cancerous or mutated cells is lost. And that's what sets us up for cancer. So rolling this all back, it becomes then very important to look for underlying cause. First of all, is chronic inflammation present? And we can assess this by symptoms. So when a naturopathic doctor asks questions about the patient's health, part of what they're surveying for are symptoms of inflammation. Do you have chronic headaches? Are you chronically fatigued? Do you have trouble sleeping? Do you have joint aches? Do you have digestive issues, et cetera, et cetera? And we can do some lab tests that will measure for certain biomarkers that indicate these upregulated inflammatory pathways. So when we get a picture of inflammation, then it's very important to find the cause, which often is digestive. So are we eating foods that we're reacting to in an inflammatory way? Or it can be psychoneuroimmunological. Are we under chronic stress and overactivating our stress reaction pathway, which in turn can activate some of these inflammatory pathways? Is there a place of chronic injury in the body that hasn't been mended? So there's lots of things that we can do to kind of find that source of inflammation, deal with that inflammation, and in turn kind of take down that inflammatory index in the body, allow the stromal tissues to regain its restraining capacity, and then hopefully prevent cancer and its regrowth.
Thank you so much. Let's see, I've got one last one here, just as a follow-up on inflammation and working with allergies and trauma and other things that may be the root cause of inflammation, and what NDs do to address that.
It's a bit like trying to find the hidden Waldo or whatever, because it's finding the cause of inflammation is challenging, in part because the train has already left the station in many cases. There may have been something that let's just take a good example. So adverse childhood events, or ACEs, can occur in our childhood, whether we've experienced some kind of abuse ourselves, whether we're, in an unsafe home environment, whatever the case might be. When that happens early, it creates a stress response in the young child, which creates epigenetic changes or gene expression changes, such that that person for the rest of their life is going to be more prone to an aggravated or a hypersensitive stress response and upregulated inflammatory pathways. So finding the cause in that case is quite difficult, and even if you find the cause, you can't get rid of it. So really all you're left with is, for some people doing, like if that, in this hypothetical situation, maybe that person would in fact help to reset some of their epigenetically altered pathways through psychotherapy, and so referral for that would be very indicated. And at the same time, we also have to then say, okay, there's some epigenetic barriers to resetting this, so we have to create almost some workarounds or some compensations. So a naturopathic doctor would look at, for example, the hypothalamic pituitary adrenal stress axis. There's ways to measure that, see if it's got some imbalances, and then use botanicals and some nutrients to help correct that system. We also might look at it on a tissue level. So given that this has been happening for a long time, what part of the body has taken this on? What part of the body is most susceptible to this? And let's say this person has irritable bowel syndrome. So then we would really want to look at how to support the integrity and the strength, if you will, of the intestinal system. Is there then some bacterial imbalances that we need to correct? Are there digestive issues? Are there food intolerances? So it can become quite a maze of opportunity to really try to uncover the main contributors and dysfunction. But frankly, that's what makes naturopathic medicine so fun, because we're not just doing protocol medicine. You could, I've heard this as a criticism against naturopathic medicine, that somebody with the same complaint or the same patient can go to 3 different naturopathic doctors and get 3 different plans. That's not because it's bad medicine. That's because each naturopathic doctor is taking this very complex whole person and identifying a path of issues within that person that makes sense to them, that makes sense to the patient, and then is applying therapies to shift some things within what they see, and then would continue on. And how people approach it, from what angle and what perspective might be different amongst practitioners, but the goal is ultimately the same. The most important thing is that each of those practitioners monitors the response by the patient on a regular basis, and so they can know if their therapy is working, and if it's not, they adjust or they refer. But as long as we're all doing that, I think there's lots of room to be creative in this process, which frankly is fun, and it makes medicine fun.
Thank you so much for spending some time with us this morning, Lise. That will be concluding our webinar, but before we close, I just wanted to invite folks to our upcoming AANMC events, and I'm showing our screen right now. And so the next event that we have is How to Be a Successful ND, Career Tips to Make Your Passion Profitable. We'll be having 2 folks who do career counseling from 2 of the AANMC member schools speaking on things that they advise students for profitable practices. So that's going to be a really awesome talk in August. And aside from that, I hope that you all found today valuable for yourselves. And Lise, Dr. Alschuler, I really appreciate the time you've spent with us as well. And our recording will be up on the website shortly, technology willing. And thank you all so much for spending an hour with the AANMC. Thanks again.